my heart, doctor. It's racing. Shouldn't you examine me?
I think I dated that nurse, though.
What about the way he's holding that stethoscope? His thumb and forefinger are meeting at an odd angle.
51 weeks out of the year, I let you run around like a monkey in a banana factory.
I thought I'd seen it all in-house, everything from near-death experiences to donkey shows, but never did I think they would be diagnosing a patient from a TV program. Who would do such a thing? Very excited to be reacting to House MD Season 4, Episode 14, Living the Dream. On this channel, we are reacting to all 177 House videos, and this will be episode 95. Let's see if I can get the diagnosis before House does as a doctor working in London.
You're drunk. You could kill her. What about our baby? Oh my God. I think he's really hurt.
Cut! This is ridiculous. This whole damn show is crap. Where are you going? My apartment's on the west side. What do you want?
An autographed picture would be nice. And I'm also gonna save your life.
Just let me go. Forget the whole thing.
That's probably true, seeing as how you have a brain tumor. I don't care if you die, but if Brock Sterling dies, Anna never finds out he's the father of Marie's baby. Your average line reading has slowed from 2.1 seconds to 2.9, which means you're having trouble reading one side of the teleprompter, which means a tumor in your occipital lobe.
So, in dealing with the on-site inspector, please behave as if it wasn't also an enormous pain in the ass.
Just in case kidnapping an actor wasn't enough, House has done it during a hospital inspection. Those things are seriously important. When I was working on palliative medicine, the unit I worked for got quite a bad inspection result because the team weren't prepared, got spooked, and started hiding in the toilet when they were asked any questions. The CEO got fired, emergency meetings were a daily occurrence, and the trustees, which I'd never seen before, started showing up. That's because a rating of inadequate not only means pulled funding, but the inspectors can actually close you down. Thankfully, on the next inspection, everyone was schooled and ready, and maybe the toilets were locked, and the rating improved. Interesting that House diagnosed a brain tumor in this actor from watching his series. He mentioned the occipital lobe as the tumor's location, but how would he know that? Well, diseases that affect different parts of your visual tract can cause different abnormalities. Cancer in the right occipital lobe means you can't see left in both eyes. A tumor in the pituitary gland, which is where fibers of the optic nerve cross, causes you to lose peripheral vision in both eyes. That's because the inside part of your retina see the outside of each eye, and the nerve corresponding to that area is the one that crosses. It's quite smart really, as that's why your brain can perceive depth, since it takes into account the same area seen from two different eyes and processes it within the same part of the brain. Pretty high-tech stuff going on in the mush balls inside our skulls. The actor that plays Brock now has agreed to just one test. Surely it'll be an MRI of the head. I'm also sure we won't just find a brain tumor sitting where we expect it to, but let's find out.
Why is House driving a limo? Until this inspection is over, you're back on House watch.
So I just press this button every time I see a light? How can you watch that stuff? Not one real moment since I've been on the show.
You have significant losses in the upper right quadrant of your visual field. You're gonna need an MRI to confirm the type and location of the tumor.
That readout says his vision's fine.
You come near me again, I'm calling the police.
You kidnapped him?
My back is killing me.
I don't care.
Amber's damn mattress.
Hold on, just gotta do something before he dials the second one. You're gonna end up humiliated, holding her purse. He needs an MRI to be proud.
Occipital frontal temporal lobes are clean, so's the optic nerve. Definitely no tumors.
See if you can talk him out of suing me.
This hospital is staffed with lunatics and criminals. Excuse me, where's Dr. Cuddy? It's numb. I can't feel it. I can't walk.
As soon as the actor mentions the lack of real movements, one catches up with him. We know his MRI is clean.
See if you can talk him out of suing me.
His peripheral vision is sketchy, and he's gotten sudden onset weakness and numbness in his leg.
It's numb. I can't feel it. I can't walk.
In the real world, I'd be thinking about B12 deficiency, especially if he's vegetarian, MS, and what would be really worrying is cauda equina syndrome, especially if he's also lost control of his bladder or bowels. That MRI needs to extend to his lower spinal cord and needs a bunch of nerve conduction studies with blood tests to narrow things down. For House though, we have to take the real world box and set it on fire because it's time to get outside it. We know the episode is titled Living a Dream Life, and the patient keeps talking about how things aren't real. So what if the patient has an abnormal sleep condition like narcolepsy? The reason why he can't walk is because he's drifting in and out of microsleeps, which can come on at any time, and he's got a version of sleep paralysis. The only way to confirm it would be to attach an EEG and do a sleep study, then watch his brainwaves perform their most grand dance. Oh, that would be spicy and has to be my first diagnostic guess. Question for you smart people: how has the average amount of sleep an adult gets changed over the last century? Answers down below and I'll answer at the end of the video.
Foot numbness has a huge differential.
He could have pinched a nerve in his ankle when he fell. You need to run an EMG test for motor nerve entrapment, or the inspector will own your ass.
So the nut job was right.
It's my heart, doctor. It's racing. Shouldn't you examine me?
I think I dated that nurse, though.
What about the way he's holding that stethoscope? His thumb and forefinger are meeting at an odd angle.
51 weeks out of the year, I let you run around like a monkey in a banana factory. All I'm asking is that you tone it down for a few days.
EMG was negative for nerve entrapment.
Test for heavy metals, organics, biotoxins, and search the home.
I thought I'd seen it all in-house, everything from near-death experiences to donkey shows, but never did I think they would be diagnosing a patient from a TV program. Who would do such a thing? Well, what did we learn from the TV show? In the TV show, Foreman mentioned a subtle change on how the patient is holding the stethoscope with an odd angle. House now thinks that's because of toxins causing demyelination, which is like nerves stripping off their outer layer like they just turned 21. There are a ton of things that can cause this, but for it to also affect vision, then it has to be in the central rather than peripheral nervous system. In that case, we still would want to image that spinal cord and most definitely take some fluid from around the spine so we can see what interesting chemicals are lurking within. Candidates that could cause something like this are, yes, MS, but since he's bored on camera, maybe he got a bit too much excitement off camera and got HIV, which could cause it. Liver failure can also cause demyelinating brain disease, but then what causes the liver failure? Definitely need more clues.
I like the pillow top.
I like this one.
How much is it?
$1,999, it's a great price.
Honey, we can't afford that. Not with a baby on the way.
How about I knock $100 off?
We might be able to afford $1,500. Whatever mattress you want. I'm fine either way.
It means if you love me, you'll buy the one I want.
Rock Sterling drinks it on the show, but Evan doesn't drink at all. He's on this whole health kick right now. Are you really a doctor?
Glioblastoma. Need more proof?
I've been out with him. He's as vanilla as they come. We made out a while, and then he just said he should go home.
He's impotent. Said he died of sunflower seeds. Causes a B6 toxicity. He can't even remember the last time he was able to salute.
Just because he didn't salute doesn't mean he can't.
13, show him. Yeah. Where can I find a decent set of knockers around here?
This is humiliating.
Heart rate and BP are climbing.
Got some activity on the Tumescence monitor as well.
Did he just finish? His heart rate's through the roof, 220 and climbing.
He's headed for cardiac arrest.
Who knew looking at breasts was a possible cause of death? In reality though, the whole process of sex and climaxing can be quite dangerous for some. I had a 26-year-old patient who fell into a coma as soon as she climaxed as the raise in pressure caused a brain aneurysm to burst. She isn't the only one either, as one study in London across 26 years found that the risk of death within an hour of sex was 2 in 1,000, and that was in young people. The cause was sudden cardiac death, as the act of ejaculation can cause the heart to enter abnormal rhythms that are quite dangerous. Definitely not what the team was expecting when starting a test on a man who hadn't had an erection in years. What test were they even doing though? It's called nocturnal tumescence monitoring. You see, when a man struggles to obtain a pant captain standing ovation, there are two possible causes: psychological and physical. How can we tell the difference? Sleep erections. You see, every man without fail who can erect a trouser staircase will do so between 3 to 5 times a night. So the patient gets an elastic sensor, so eloquently called a Rigiscan monitor, wrapped around their stretch Armstrong, which is read on a tumescence monitor while they sleep. If there's no issues overnight, then their body is capable of having an erection, so the problem must be psychological. If there's radio silence, then the hardware may need some work. This whole sunflower seed situation seems to not have that much relevance, since having too much B6 wouldn't cause his heart to explode with a pass on the tumescence test. The fact he's been eating more healthily now is a clue though. Is it a personality change? Could he be lacking a different vitamin from meat? Or maybe it was alcohol that was treating whatever condition he had. There's some evidence that moderate amounts of alcohol could reduce the risk of heart attack and risk of gallstones, neither of which seem to be much of a factor here though. There is an insanely rare condition called familial encephalopathy, which reportedly does get better with red wine as well. Maybe he was masking it by drinking and now he's stopped, the condition is worsening. That's got to be my second diagnostic guess.
We shocked his heart back into sinus rhythm. He's stable, at least for now.
Could be Graves' disease. Extreme hyperthyroidism leads to systemic problems, including numbness, vision loss, and cardiac arrest.
We should fry the thyroid before it fries him.
Protocol says we should do an iodine uptake test.
You keep food in the morgue? The accreditation board will light us on fire for this. You're gonna get me fired over a sandwich?
No, over a TV. Dr. House.
Dr. Jamie Conway, I've heard your name.
Most people have. It's also a noun. You miss me.
You miss me. I miss the puzzles. I don't miss you.
His thyroid looks normal. Everything looked too bright to you? It's the iodine.
His kidneys are failing.
Is any organ off limits for this disease? First his brain, then his second brain, and now it's going for the kidney shot. Kidney failure does work very well as another clue though. You see, the causes can be classified as 1 in 3. Pre-renal, which is a problem getting blood to the kidneys like in sepsis or low blood pressure due to shock. Possible considering his heart nearly stopped. The second class is renal causes, which is to do with the kidney itself. This is where the spiciest diagnoses are like funky autoimmune conditions and vasculitides, and the third is after the kidney, like in the bladder or the tubes going to it, where there's obstruction like a big prostate, then urine can spill back into the kidneys, causing them to fail. In this case, the second option seems most likely. So what can cause the kidneys to fail from the inside out and all his other symptoms? Well, metabolic could be something like diabetes, to be fair. Have they even done a blood sugar? Could explain all of his symptoms. With his recent health craze, maybe he's gone for organic fruit that could be contaminated with infected urine. Degenerative would include multiple systems atrophy. Neoplastic could include, this would be spicy, a testicular cancer causing high levels of a hormone called HCG, which can trick the body into thinking there are high thyroid levels without them actually being high. And inflammatory includes vasculitis like Wagner's, or systemic sclerosis could also do it. Toxic definitely could include heavy metal poisoning. I like the testicular cancer theory there, as we know his penis is working, so maybe the fact he can't get it up is because he's not worried about his club, but the giant golf ball sitting next to it. Let's get more clues then.
Put me off. You were wrong. So tell me to my face. Never hesitated before. Boards turned you into a coward.
We need to run ANAs for autoimmune.
Let's see how this baby handles.
What?
You bought the firm mattress. Why would you do that? You were supposed to get the one you wanted. I need you to take care of you.
When I get out of here, I'm not gonna be afraid anymore. I mean, how many guys get a second chance? I'm gonna start by being a better father to you. Just help me get out of this bed.
This guy's brain is about to boil. What's your name?
Dr. Brock Sterling.
Good news is, last time Brock was in a coma, he fathered 2 children. Test for fungi, parasites, all creatures great and small.
I want a waterbed.
It's not an infection, it's an allergy.
Oh, we have an epiphany moment, and I have one diagnostic guess left. Now, when someone says allergies, we usually think of snotty noses, wheezing, rashes, and EpiPens, but that isn't the only type of allergy there is. You can also have allergies triggered by infection, like allergic bronchopulmonary aspergillosis, but that usually causes respiratory symptoms, which our guy doesn't have. There are other interesting types of hybrid allergy as well, like Churg-Strauss syndrome, which is also known as eosinophilic granulomatosis with polyangiitis. It's an allergic type of vasculitis which usually causes chronic nasal congestion and asthma, but it can more rarely cause fevers and dysfunction of the nervous system, which he clearly has since he's mistaking house for his daughter. I hope she doesn't have his stubble. To diagnose it, you can test for a specific antibody known as PMO anchor, and if you find it, then it's very treatable with immunosuppressants like steroids. That has to take my third and final diagnostic guess, and we are locked in. Question for you smart people, what percentage of people who think they have a food allergy actually do not? Answers down below and I'll give you it at the end of the video.
Allergens could trigger an allergic vasculitis. There were chrysanthemums in his dressing room. Chrysanthemums contain pyrethrin. It's a neurotoxin and a known allergen.
He has an infection. If we give him steroids, we'll kill him.
100 milligrams methylprednisolone. It's one patient.
You want to give one patient 100 milligrams?
Why don't I just...
You're not allowed back here.
What is it about this severe and deepening coma that makes you think we got time for protocol?
My job's on the line. Your job is on the line. If he dies, let me know so I can pack my things. Tests are negative. Patient's negative for all floral allergies.
The steroids worked. House was right. It was an allergy.
To what? I was wrong.
I can't sleep. I hate the waterbed.
I actually kind of like it.
Christine, doesn't compare to the happiness that I feel.
What was the verdict?
$200,000 fine.
Patient. He's allergic to quinine.
House has successfully failed the mission. It was the tonic. I didn't get exactly what the trigger was, but allergy-induced vasculitis was the right answer, and steroids got him better. So I will half take that. Would have been epic if I got that, especially since my wife has the exact same allergy. If I can't get a condition right that my wife has, maybe my brain's suffering from a quinine allergy too. Very spicy episode, 8.7 out of 10 entertainment. Love the whole TV doctor situation and kidnapping. 8 out of 10 accuracy. 8.5 out of 10 diagnosis. Now the answers, the average adult sleep has dropped from 9 hours to 7.5 hours in the last century. 50% of people who think they have a food allergy actually do not, but don't be challenging that theory without medical supervision though. This episode doesn't make full sense until you watch the previous one where being too nice is a disease.